Hello, my name is Maria, and today I will demonstrate the complete bath. And first, I should check the doctor's orders, see what the doctor recommend, and then I will bring the supplies with me. I will have the towels, the bath towels, the disposable wipes. I will have some cream, soap, gloves, basin with water. I will have it with me. I will have even the sheets and everything which I need for to change the bed in the end. And what I will do, I will take them with me in the room. I will knock at the door, introduce myself. My name is Maria Harris. I will be your nurse for today. And may I have your boundaries, please? Okay. May I have your date of birth, your name and date of birth? Okay. Do you have any allergies to any soaps or latest? No? Okay. Well, today we'll do the complete bath and we'll change the linens as well. And do you have any questions? Are you okay with that? Okay, good. Do you need to go to the bathroom? No. Okay, great. And I will assess his ability to help me with the bath, to see the tubing, the IVs, the catheters, just to see everything what's around the patient as well during this time. And then I will arrange all my towels and everything what I need beside the bed. And I will I will wash my hands, and I will put the gloves. Okay, and now I will take the bath towel. Okay, I will take the bath towel and put it over the patient lengthwise, and I'll make sure that the patient can hold the bath towel as I take off the sheet and the blanket. Okay, and all these the linens, be sure not to put them on my clothes and put them in the dirty linen basket. And now I will put the rails up, and I will go to bring water, and I will bring water for the patient. I will let him try the water. Okay, and I will make the bed to the level comfortable for me, and put the rail down and tell the patient to come as closer on my side towards me. Okay, and now I will take snap the top of the gown in order to remove the gown, and I will snap it. Now I have to start with the unaffected arm. Okay, and take it off, and then if I have any IV tubing, I can turn off the IV, and if I have a gown and I cannot snap the top, I can put the bag through the sleeve of the gown and then hang it back and turn it on. And I have to be sure that it's set the right parameters and right infusions as well. And sometimes we can be like that during the bath time, depends of the patient. And of course, I have to assess the patient tolerance, how much he can help me as well. I'll remove the gown and put it in the dirty linen basket. And now I will have the towels. I'll have the washcloth in the water. I will have a towel under the head of the patient, and I can lift up the head 30-35 degree if it's not contraindicated. If it's contraindicated, I have to keep the patient according with the doctor's orders. And I'll have a towel on his chest as well. Okay, and now what I will do, I will wring the towel, and I will not use the soap for the eye, and I will just put it around my fingers, hand, and make it in a nice bath. And of course, I need to ask the patient if it's okay for me to wipe his eyes and if he has contact lens as well. And I will tell him that I will not use soap for his eyes. And I will clean the eyes from inside out gently. Okay. And then with a dry towel, I can dry over the eyes as well. Okay. And now I rinse and ask permission if he wants soap on the face or not, and if he does not want, I don't put. If it's, I'll put a little bit of soap and wash the forehead, the cheeks, the neck, behind the head, on the nose, under the chin, everything. Then I will rinse from the soap, wring it very well, then wipe again all the parts, and then with a towel I just dry it nicely. Okay, and then I'll go to the arm and I'll put a towel lengthwise. And by the way, the towel which I use for the face, I should put it in the dirty basket, linen. Okay, and now I will wring it, put a little bit of soap, and then wipe from the wrist up to the shoulder. Very easy, slowly. Then I will rinse it, wash it, wipe it again, and then I will dry the shoulder and the arms well. And then if the patient would like to soak for a few minutes, 1 or 2 minutes, the hands in order to clean very well under the fingernails and soft the skin, he can, and I'll bring the basin very close to the bed and let him soak it. After he soaked with a rag, rag, I will just cleanse between the fingers and everything, and the nails according, I should file them or cut them according to the policy of the place, and be sure that everything is dry. And then I remove this and put the arm under the bath towel, not to be cold for the patient. And of course this I will use it for the other arm. Put the rail up and go on the other side of the arm and do the same thing what I did for this one. Okay, and now what I will do is keep the towel on the chest and pull the bath towel until to the waist, nicely, slowly. Okay, and now, and be sure that the patient is comfortable all time, and ask him and so on. And if the water cools too fast and the patient likes warm, then change the water, change the gloves, and bring clean water. And I wring the rag, put the soap, and just the chest. Now for the female, I can leave the towel like this, and then just put my hand, lift up gently back the breast of the female, and clean under very well, wipe it gently, and then rinse the rag with no soap, wipe it again, and then with a dry towel wipe it very well under. And then of course I will wash the top on the chest, and be sure that I will wipe it for the patient not to be cold. Okay, and then I will wash the rag, wring it, put the soap, and wash the abdomen. Now I have to be careful about around the umbilical, that will be clean and nice, and then rinse it properly and dry it properly as well. Okay, one thing I didn't mention about the arms, I should raise them about around above their head and wipe it from the wrist towards the axilla, wipe it very well, rinse it, dry it, and place deodorant. Okay. Okay, after the umbilical, and wipe it nice, and I can remove this towel as I pull up the a clean bath towel on top for the patient to be comfortable, not to keep the wet towel on the patient. Okay, and this will go in the dirty linen. And now I will do the legs. Okay, the leg. And when I do the leg, just be sure that you will drape it nicely, that the private areas will be secure, and everything will be nice, and the patient will not be embarrassed revealing anything. Okay. And what I will do, I will wring the rag, and I will wipe it from the ankle to the knee first, and then wring it again, wash it. I will rinse it, and of course I will have the towel under the leg. I will have the towel under the rag, the leg, and wipe it, and then the rag from the knee, wipe it until to the inguinal area, then rinse it, and then wipe it nicely. And if they would like, we can put the feet, we can put the feet in the to soak them, and to let them soak for a few minutes, and then clean very well between the toes, file the toenails according with the policy, and be sure that everything will be nice and dry, and repeat the same procedure on the other side of the leg. And of course change the waters again because maybe it's cold, and be sure you keep the patient covered all the time. And now of course if the patient would like to uh, would like to clean the genital area, we can give them disposable wipes, or we can do it ourselves, the way how the patient will like it. Okay. And now as I do the bath, all the time I should assess the skin, every aspect, every for the chest, the legs, everywhere I put the rag, I should assess the skin to see how is it, the skin, the tissues, just an evaluation, a good assessment to be done. Okay, and now I will ask the patient, and if the patient would like to put the lotion on the legs, on the arms, on the feet, on the arm, on the hands, I can put lotion as well. And now the patient, I will ask the patient to be sure. I will have the rail up, and ask the patient to move, to go towards the rail, and give me the bag. And as he's turning, be sure that the private areas are covered, that everything is nice, and the bath towel will go over the shoulder, and I will just let only the back area to be open in order for me to clean it. Now, if I see any feces on the sheet or on his back, I have the disposable wipes, which I should clean it very well, clean this very well, change my gloves, wash my hands, and put the rails up. Don't leave the patient on one side with no rails in order for the patient not to fail. And I can change the water, I can change the gloves, wash my hands. Then I have clean water with a clean rag, and I'll put some soap, and I'll rinse the back from top down. Okay, and wipe it, then I will rinse it, then I will dry it, and dry with a towel. And now the buttocks area, I will use the rag, and I will do it from the front to back. And be sure that you wipe it very well, even the anus area, that you open the buttocks, and everything will be wiped good. They will be rinsed, and then they will be dry very well. Okay. And now I'll put the patient back in the position, which supine position. And now I will give him a clean gown, help him to put the gown on, and then I'll change my gloves and put new gloves. I'll ask him if you like me to comb the hair, brush the teeth, shave, or put the cosmetics. And then I will wash my hands, apply new gloves, and change the linen. Be sure that the soil linen will not touch my clothes. I'll put them in the dirty baskets. I will wash my hands again, and then I will check that all the tubings are working properly. Be sure that with the catheter, with the IV, everything works good. And this is a clean sheet, and the bath towel was removed as well. After that, be sure that I have the call ID. Lower the bed to the lower level, put the rail up or put them down, depends what the patient will like. Put the bed of the head of the bed up or down. Make the patient to be very, very comfortable, okay? And I will remove and I will ask him, do you need anything else? No, everything, are you okay? Are you comfortable? Yes, he told that it's comfortable. Now, I would like to mention before we move on regarding the unconscious patients, regarding their eye care. The doctor will prescribe the eye drops. Then I have to be when I open the eyelids, put the drops and then pull back the lid and even put the patch on top as well. Okay, to be sure that the patient had the eye care too. And sometimes we don't do the complete bath with the rags and water. We have the disposable wipes. We'll warm them up. Be sure they will not be too hot or cold. And there are 6-8 disposable wipes, and you will use one wipe for one area, and use the wipes. And be sure during the time that you keep the patient warm, that you will dry with the towels, that the patient will be comfortable all the time. Okay, and now I will take all my supplies, put them where they belong, put them in the dirty linens, put them in the towels, the baskets, everything will be removed. I will wash my hands, and then remove my gloves and wash my hands, and then I will document how the bath went, if the patient collaborated, if the patient was active, and how that was completed. I hope that everything is done. Thank you.